Hello, everyone. We're going to get started with our webinar here in another minute or two, but welcome. Glad so many of you joined. We had a great response RSVP wise, so we're expecting a nice crowd. And then, as you know, if you've watched these before, many people will watch them off of our website in the future. So we'll get started probably in another 90 seconds. Brad, that setting is still cracking me up. It's too perfect. It's too perfect. It's like one of
Yeah.
those fake backgrounds, but it's all too real. All right, good. Well, it's the top of the hour. We want to be really respectful of everybody's time. So, welcome to the May 2026 USENT Supplier Spotlight. We are thrilled to be joined by Brad Baker, who's the president of MTI, one of our newer supplier partners. Brad is a good friend and just a outstanding human being. We got to know each other well at the Academy meeting last fall in Indianapolis. So Brad is the president, but he co-founded MTI many years ago. I don't know how many years ago, Brad, but with your father, and then has had to put up with two of your brothers working with you along the way. But you're the king of the hill, so you are the president. Whether that's a reward or a punishment probably depends on the day. But
They
anyway,
just blame me for everything.
yes, that is the nature of our jobs, right? Brad has four boys, and that background is real. Brad is in a hospital where one of his sons underwent an emergency procedure earlier today, but is doing well, thankfully, and so Brad's able to still join us as scheduled. I guess the other thing that jumped out at me, Brad, about you is you're an avid fly fisherman, love the outdoors, like so many of us too. So thank you for joining us.
Thank you for having me.
Well, obviously, many of you have MTI equipment throughout your office, like I do. I have many exam chairs specifically. And so we wanted this to be a very educational and frankly, it's slightly frightening uh, discussion about some new ADA regulations. If you're not familiar with that acronym, we're not talking about the American Dental Association. We're talking about something from the federal government, the Americans with Disabilities Act, which has been around in some form or fashion since 1973. Uh, the act is designed to make sure that all buildings and dwellings have reasonable safeguards for those with disabilities. My wife is an interior designer, as many of you know, and as she has finished out several of our offices over the years, we've had to pay great attention to the ADA in areas such as the handles that we have around our restroom toilets, the height of the toilet, the height of the sink, the ramps that lead up to our audio booths, the type of carpet that's in the audio booth, on and on and on. And so we're not going to talk about that so much tonight as our exam chairs. And so I think that'll be surprising and eye-opening to many of you, and we'll talk about the ins and outs of that. So, Brad, as you know, in my two offices, I have, gosh, at least two or three of your beautiful chairs, including in my two operating rooms, my procedure rooms. But I don't have any special hardware to accommodate those with disabilities. So, am I okay? Am I okay if I just had my main office outfitted? I guess what are the rules around that? What are your suggestions?
Actually, the standards that were released, you have to have an accessible examination chair at every one of your locations if you fall under a covered entity. So, 10% of every one of your rooms at every one of your locations, if you are falling under HHS or DOJ, have to have an ADA compliant exam chair. So But maybe I get back into a teeny bit and talk a little bit about history of the ADA, because we kind of
Enlighten us,
brand
please.
the ADA as one thing, and it kind of gets that name ADA compliance, and there's a lot of other acronyms that go to it. As you mentioned, clear back in 1973, the Rehabilitation Act, Section 504 of that, and the 1990 Americans with Disability Act, where mostly ADA, the terminology comes from. Those were both federal regulations that prohibited discrimination against people with disabilities. Well, in 502 of that 1973 ruling, it formed the Architectural and Transportation Barriers Compliance Board. Okay, today their scope's expanded into more into other areas, and they go by.
Wait, government is expanded? I'm not familiar with this concept. What are you talking about?
Definitely is expanded. So they've expanded what they want to have scope over, and been given more responsibilities. And so now they go by the U.S. Access Board, or United States Access Board. So, but the U.S. Access Board is only able to come up with standards and guidelines for what makes something accessible, whether that's ramps or grab bars in bathrooms or whatever it might be, exam chairs. They come up with standards, but they have no enforcing authority over that. So they just come up with standards of what the device needs to have so it's considered accessible.
Okay, they make the rules, but they don't enforce them.
Yep, exactly. So usually they work with a department like the DOT, DOJ, something like that, that adopts the standards and enforces them. So what happened is in 2010, when the Affordable Care Act came out, it required the Access Board to come up with standards for medical diagnostic equipment, or MDE. And that's everything from weight scale, mammography machines, x-ray machines, and exam chairs and tables, maybe a couple other products. So it told them they had to go out, create standards for these products. So in 2012, they formed an advisory committee. Fortunately, we were able to be part of it, as well as some other manufacturers of those products. We go out to DC every month for a while, talk to them, tell them what's possible, what's not possible, and kind of help develop standards for these products. And then about 5 years later, in January of 2017, that's when the Access Board issued their first standards for accessible medical diagnostic equipment, which at that time, no one had adopted it. So at that time, it was only a voluntary standard. So you didn't hear a lot about it in 2017.
Yeah. And as you educated me last fall, though, this year, 2026, things have changed again. So can you update us on the latest legislation and mandates?
Yeah, so what's happened in 2024, about mid-year, both HHS and the DOJ adopted the Access Board's 2017 standards for MDE, which includes the exam chairs, as I mentioned. So, and that was only for what they call a covered entity. So what's a covered entity? A covered entity for HHS is anybody that takes federal funding assistance. So if you take Medicare, Medicaid, CHIPS, or any other federally funded program, you fall under HHS, and you are a covered entity, you're required to comply with this regulation. Or if you're Title II of the DOJ, which is state and local governments, you are required to comply as a covered entity. And the DOJ right now is evaluating Title III, which is any public building or any public office building. So essentially, if DOJ adopts for Title III, it's going to be every medical practice, every dental practice, every
it's everybody. Yeah, it's functionally everybody.
So that's the big thing that happened in 2024 is somebody came along, both HHS and DOJ, and they adopted that standard, making it enforceable.
Okay. So then bringing it back to my practice, which is representative of so many of our US ENT practices, we don't have any special accommodations on our exam chairs. And so it's hard to describe that without a visual, I know. But from what you've taught me and you've shown me, essentially one of the armrests is replaced with a apparatus that can be completely opened and moved to allow a transfer horizontally of a patient from a wheelchair, for example, into the actual treatment chair. Can you describe that a little more eloquently
Yeah.
than maybe I did.
And maybe I'll expand a teeny bit on what there's mostly 4 things for an exam chair that you have to have, and what you're describing, what they call transfer support's one of them. The hardest thing for manufacturers to meet, and where most don't meet the standard, is they have to have an entry height of the chair that's between 17 and 19 inches. And so,
So not
and
very high. That's low. That's very low.
very low. But the other thing that's really tough on that is the access board in their standard tells you how it has to be measured, because every manufacturer measure their heights differently, right? The back, the front, compressed, whatever.
Like your
But
fish that you catch, right?
that's right. It gets bigger and bigger, right?
Right.
But they came along and said it has to be measured at the front of the transfer surface, which is the front of the seat, in uncompressed upholstery. So basically putting a straight edge across your front of your seat down to the floor has to fall between 17 and 19, or at least has to power into that range, or move into that range, really. That's one of the really, really big requirements of it.
Yeah, that's 1.5 feet. I mean, that is not much at
Yeah,
all.
it is. It's pretty darn low. When we tried to develop our products, it was a very, very difficult.
Yeah, to have the actual mechanism, the engine in it, has to be very miniature to accommodate that. Okay.
Yeah, and one of the other big challenges for an ENT chair is you have a footrest that comes down, and then the plate that your foot sits on, right? So we had to fit all of that in that space, and we actually ended up with multiple patents protecting our product to help us meet the compliance requirements for ADA, and particularly the 17 to 19 inch requirement. That was the biggest hurdle.
And you walked me around. There are lots of competitors to you, right? And I know not everybody meets these standards, or they have creative ways to say that they're compliant, right? But you think MTI is far and away the most compliant? Is that fair to say?
Yes, I'm a little biased, but absolutely, we have 11 compliant chairs. Now they're outside of ENT as well as in ENT, but I'm not aware of any other ENT manufacturer in the entire world that has an ADA compliant ENT chair.
Really?
Right?
Okay.
There's some compliant exam tables and some general procedure tables out there, but as far as an ENT chair that you might use for minor examinations or even procedures, there is nobody else that I'm aware of that has this compliant chair.
Okay.
The other real big thing that you mentioned is that transfer support that you have to have on the chair to make it compliant. So think of the grab bar for your bathroom that's required. It's the same thing, but for an exam chair. So,
and that's interchangeable with like my existing chairs, right?
Yeah, ours is. So
okay.
Yeah, we redesigned our transfer support so you can put on any one of your G2 compliant MTI chairs. You can move room to room to room. There's no additional things you got to add to your chair. You just plug it into the already mechanisms that are already there. It's lightweight, lower cost than what our initial one was. And so we developed that to meet those standards. So an armrest doesn't qualify for a transfer support. It has to meet certain regulatory requirements and specifications to meet that. So those are the biggest things. The other thing is the width of the transfer surface has to be 21 inches wide and 17 inches deep. And there are quite a lot of ENT chairs that are not 20 wide. So that's another requirement that they don't meet in a lot of ways.
Okay.
So
who knew?
Those are the big things.
Yeah. So you're making me nervous as we speak. So you mentioned about 10% of our chairs in this topic have to be compliant. So, in both of my offices, I have, I think, 12 exam rooms or something. So we would probably need 1 or 2 in each office at minimum to be compliant. What happens if we're not? I guess who checks this? I mean, we're going to do it, but who checks this? What are the implications, maybe?
So they're in the regulations. There's no specification what's going to happen to you. There's no one's going to come out and measure or verify this. That could happen down the road, similar like buildings, get inspected for ramps and so forth. But for now,
but not JCAHO or some of these OSHA or any of these other organizations, CLIA.
So it's not specified they're going to. They certainly could, because it's a regulation. But likely what's going to happen is anybody can file a discriminatory claim with one of the regulatory bodies like HHS or DOJ or JACO or even the Access Board, that you don't have a compliant product for them, just like if they went to the building, didn't have a ramp or anything like that. They can certainly file a claim, which that regulatory body then probably investigate, and they could certainly take away your federal funding. So Medicare, Medicaid, they could penalize you, they could do all sorts of things. Or there could certainly be a lawsuit that would come out of that, which would be really quite likely for that to happen is a lawsuit for discriminatory reasons.
Well, that's scary. Now remind us of the dates. You said, I know it was sometime this summer, but do you know
Yep.
them off the top of your head? When do we have to be compliant by?
Yeah, so HHS is July 8th of 2026.
Wow. Okay, so just 2 months from when we're
Yeah.
recording this. Yeah.
Pretty close. And then the DOJ is August 9th. So it's basically like midsummer this year. You need to have 10% of your rooms at every location with a compliant chair and a transfer support in that facility. So I would tell people, I'm assuming this is going to drive a fair amount of demand. Lead times will probably start to creep up a bit with everybody rushing to get this done. So I would say get orders in early, talk to our solutions advisors, and they can help you through the process, help you understand what your requirements are, and get that order in as early as you can so you don't have the problems with lead times.
Yeah. Well, I mean, this is going to be an issue really for every single one of our practices. I have to think so. And I haven't, until we spoke, which was just last October, I hadn't even really heard this issue. So are your competitors scrambling to have compliant chairs in this instance? I guess, why are we hearing so many different messages about this? Or also, why are we not hearing much about it at all?
It's interesting. We've been trying to advertise and talk about it since it came out in 2017, as far as the standard and how we met it. But it tend to always happen this way: is when that regulation date starts to come, the interest all starts to drive upward. But it's been really pretty confusing, I think, for the market over historical years, that manufacturers, clear back in the early 2000s, were saying, I've got an accessible chair. And until the standards came out in 2017 from the US Access Board, there were no standards in existence. There was nothing. There was some guidances, like the DOJ had a guidance for accessible design. There certainly was the ADA regulation from 1990, but it didn't specify anything about what made a chair compliant. So there's a lot of this accessibility, and they assumed the heights and widths and so forth. They actually mostly only talked about heights, but it wasn't measured a certain way. People were claiming it at 20 inches, 23 inches. There's no rhyme or reason to it. So because of the way the Access Board requires you to measure it, most manufacturers have not re-specified their products and measuring it per the standard at the highest point. So you might see a chair that's 20 and a half inches or 21 or 19, but it may not be that measured per the standard that way. In fact, we had a competitive chair once that was claiming 20 and a half inches, and we measured it per the standard, and it was 23 inches. So it was 2.5 inches lower than what the standard was. And my funniest story was, we had a customer looking at our product and a competitive product, and the competitor was trying to complain they were compliant, and they sent the customer a picture that they subsequently forwarded to us. And it was a chair with no upholstery on it, measured at the back of the chair, the rear, and it was an angled seat, so it was the lowest point. And they're measuring from the frame to the floor, trying to claim it was 19 inches. And it was the silliest thing that they even tried to attempt that. They obviously don't know what they're talking about, but there is a lot of confusion about it. But like, simple facts: get a chair that's 17 and 19 per the standard, get a transfer support for it, and do it by midsummer. And 10% of your rooms. That is really like the key to making this all work right.
Okay. So is this the typical government thing where they put things in action, but we just have to eat the costs? Kind of like in 2010 when we all had to go electronic on our charting systems, and there wasn't any incentive to do it, but instead we were threatened with fines if we didn't. So who pays for all this? I guess we just have to eat it.
Well, it is the facility's responsibility. However, the IRS does have Section 44 disabled access credit, which allows you to take up to a $5,000 credit, so a dollar for
Oh,
dollar credit off your taxes for purchases of uh, this devices that meet NDE. So if you just need to buy our transfer support, you can take the credit on the transfer support up to a maximum amount. And you can do that every year for every piece of device, and you can take it one time on the device. So essentially, the way it breaks down is um, the first 250 is deductible. The next 50% of your purchase price, up to a max of a $5,000 credit, you can take as a credit, and then the rest of that, so in this case, 5250, you can take off on Section 179. And so
yeah.
if you were in a 32% tax bracket and you took the full tax credit and you bought a chair, let's just say it was 10,250, since that's some easy math for us. The first 250 is deductible. Half of the next 10,000 you can take up to that $5,000 tax credit, and then the rest you can write off in Section 179. So that chair that costs 10,250 with a transfer support, you would pay about $3,600 is all for it. So it's not, I mean, it definitely is an expense, but you do get a lot better technology. And I tell you, these accessible chairs are pretty darn nice to put patients in and out of there. So much easier getting out of. And the technology we built into these
Yeah.
products is just so great.
Well, yeah, even our non-disabled patients. I mean, I have these two chairs, as I mentioned, in both of my ORs. So sometimes patients are sedated, either with oral sedation or even IV sedation. So it would make it just that much easier to transfer them into their wheelchair or stretcher or whatever.
Yep.
Okay, good. And I'm glad to hear that there are tax credits. That's better than nothing for sure. And it sounds like
Yep.
they're fairly substantial. Okay. Anything else? I mean, we want to reserve. We've got about 8 or 9 minutes for Q&A. So people, please feel free to type in the chat. You won't be able to raise your hand and talk, but type questions in the chat, please. Julia and my team will monitor that. But Brad, anything else before we go to Q&A?
This is a lot to take in. You guys already have a lot of stuff just being a physician and running a practice, on top of this. I would tell you, we've got a lot of tools for you that can help you. You can visit our website at mti.net/ADA. It goes over all this. You can go to the tax calculator on our website to help you. The easiest thing is just reach out to one of our solutions advisors. You can find their information right on our website. Just type in their zip code or call us. We'll get you in touch with them. They can kind of walk you through step by step, help you figure out what you might be, need to pay for it, and then kind of make sure you're in compliance with everything and help you along in this situation we find ourselves in. So
That's great. And our account managers can also do the same. Obviously, again, we have a formal relationship with MTI, so there are some nice discounts and other advantages for our members with MTI. Okay, a
absolutely.
couple questions are already coming in. So, we touched on this a little bit about what the penalties might be for non-compliance. We talked about the lawsuits and such. Um, have you seen or heard anything else, maybe outside of the exam chair arena, where there's been problems?
Yeah, in fact, this was quite a few years ago. In fact, is the American Disabilities Act and the Rehabilitation Act of 1973 have been around since those dates, and so you cannot discriminate against people with a disability. And so there was a situation with one of the large hospital systems that they did not treat a patient the way they should have been treated, and they didn't get equal care. Even though there were no specifications of the device, they didn't take the patient, put him in the chair, or put him in the table as more of a table, and they didn't treat that patient the way they're supposed to, and they were faced with a lawsuit and cost them. I don't know exactly how many, but I'm sure quite a few pennies. So
Yeah, I'm sure
it's definitely real, and especially when you get anything to do with discriminatory practices with disabilities can be really
we've got to be
really frowned
compliant.
upon.
We've got to be compliant. All right, switching gears. So Jeff has a question. What is the typical weight capacity for your chairs? patient weight?
Patient, so our patient capacity is 725 pounds. So we have
Wow.
plenty of ability to handle any patient size, big or small. So,
Yeah.
um,
And then follow-up question, who does the training of how to operate these things and to properly transfer
oh,
the patient back and forth? Does your team
that
do
is
that,
actually
Brad?
really, that's a great question because I forgot to mention one of the other requirements of the standard and what HHS, actually, it's really what HHS and DOJ said is that your staff has to be trained on, or what they call qualified staff. So we have put a QR code on our transfer support. It's a couple-minute video. You just have your staff watch that, and they have to be really trained on two things. Is one, they have to be trained on how to use the accessible exam chair, and two, how to safely transfer a patient onto and off of the exam chair, or help assist the patient transfer onto and off of the chair. So that is also a requirement of this, is that the healthcare professional has to do that. So great, whoever asked that question, great question.
Yeah. And two more, we've still got a few minutes, and so keep them coming, people. So, you know that I do a lot of sinus procedures in the office, and a lot of times I'll use a magnetic navigation system. In particular use the Stryker system. So we have to be very careful with the amount of metal in the headrest, for example. I mean, sometimes I have to take my smartphone and my smartwatch off if I'm near the patient's head. So have you used these, I guess, with some of our modern ENT navigation systems like Stryker, like Medtronic? And does the metal in that transfer rail interfere with the accuracy of the navigation?
Yeah, great question. No, it does not. It sits much lower and out of the way. We've actually been working on developing a special headrest. Our headrest has easy ability to interchange. You just pull it out, put a new one in. And so we're developing a headrest that actually will take your navigation system, put it right on our chair. You can use it, take it right back off, and put on the normal
Oh,
headrest. It's
good. Okay.
seconds to
Yep.
do. So
I'm going to look at that too.
yeah, we're real
What,
familiar with that.
all right, since we're coming up on mid-July, I mean, what is the lead time for our practices, which we now have about 350? What is our lead time for us to get these chairs?
So lead time right now is running probably 4 or 5-ish weeks, somewhere right around there, maybe 6 weeks. But
Okay.
I can't stress enough is we will see people out there needing to buy, and they're going to wait and wait and buy, and our lead times will increase just because demand is going to increase. So really, to be safe, I give yourself 10, 12 weeks before when you order it to when you want to get it. And our distributors will work with you to get it delivered and installed kind of when you want it. Like if you want to order it today and not get it for 6 or 8 weeks, they're 10, 12 weeks, they're happy to do that. But just don't wait and order it because lead times are 5, 6 weeks right now. Um, get the order in because it's going to be like COVID all over again. It was, I mean, those lead times went crazy insane because of demand.
Supply
So,
chain, right? Everyone's favorite
yeah.
phrase back then, supply chain,
Yeah.
supply chain. So we still have a couple minutes. So what
Okay.
other options that don't have anything necessarily to do with the ADA, what other things can you add to these chairs?
Well, for us, we also make ENT cabinetry, so we build a system that incorporates the functions of chairs and cabinetry together. Depending how you practice, you can put back-mounted lights on the chair, or if you use fiber optic lighting, you can put that in our cabinet. You can get multiple different headrests for your chair, depending on how you like to operate, or if you have a certain procedure like the navigation system, where you want to swap out a different headrest, you can certainly do that. But they are by far the highest technology patented devices that are out there, and
Yeah.
just so smooth to operate.
It sounds like they're pretty flexible as far as changing components out. Jeff has a follow-up question on that too. Like if the measurements all are fine, is it pretty easy just to then add the transfer support?
Yeah. So anybody that has one of our ADA compliant chairs, and we brought our first one out in ENT in 2019, so it's been quite a few years.
So if
So
we
if you
have a
bought a new
reasonably
chair,
new chair, it's probably compliant.
it's probably
Measure,
compliant. Yeah.
measurement wise. Yeah. Okay.
Yeah, so it would be fine if, as long as it's one of our newer chairs, and you just take the transfer support, pull the arm out, plug the transfer support in, and it will work on any chair. So you don't need to adapt anything to any chair you have of ours. And you can move that transfer support from room to room to room to room. So it doesn't lock you into one of your rooms being your ADA compliant room. You can schedule that patient in your workflow anywhere that's open in that room, and you just move the transfer support to that location.
Okay.
You,
Good.
you end up needing more than one transfer support, you buy another one, and pretty simple.
All right. Good. So as I told you, it goes fast. So our time is up, but excellent job. You covered a lot of ground in a short period of time. Anubhav, if it's easy, could you type in the website, the mti.net/ADA, and that's where, again, you can calculate your potential tax credit. You can connect via your zip code to the appropriate MTI distributor to order, and then go from there. So, Brad, thank you again for your time, especially with your family sickness going on. But I hope he's okay, and really appreciate it.
Great, he's doing good. Thank you for being concerned, and appreciate being with you today.
Absolutely. All right, everybody, have a great evening. We'll talk next month.
Thanks.